Dr. DeCubellis here. Welcome to the 7-Day Posture Challenge. Thanks for joining. In these next 7 days, we're going to go through and do a new video each day, not only going over details of posture and what to look for, but what you can do to increase your posture. The goal is that by the end of the 7 days, you should have better posture, a better understanding of what makes bad posture, and know how to spot it when it happens. So let's start there. We're going to start about how to tell if you have bad posture. So we're going to go ahead and look at especially the upper kind of body here, okay? And when we're talking about posture, we're really talking about the spine being nice and straight, how the shoulders are, and how the head is, okay? So let's go ahead and look at me from the front first. So the first thing that people look at is look at the shoulders. Here's where the first misconception comes in. People look at the shoulders and they think that your shoulders should be level. Well, you can see that my shoulders are not level, right? This shoulder and this shoulder, I'm going to put my hand down. See how they're not level? How this shoulder is a little bit lower than this one? That is 100% normal because I'm right-handed. My right shoulder is going to be a little bit lower. Because I'm right-handed, I use this arm more. I have more muscle developed. Muscle is going to be heavier and it's going to cause the shoulder to dip a little. So whatever side is the hand that you use, that shoulder should be lower. If they are equal and you're not ambidextrous, then we actually have a problem, and that means you have bad posture. So your shoulders should not be even. They should be a little bit like that. Now, not like this. You shouldn't be walking around tilted. We're talking just a little bit of a minimal change. Sometimes it's easier to see with your shirt off too. Next thing is when we talk about your head. What we should see is the head should be straight up and down, nose straight in the center, eyes should be equally level across. Now, the thing about this is that your body has what's called righting reflexes, and it's going to do its best to keep everything just like I said. The reason for that is because if you don't have that, not only are you going to be falling over, but it's going to cause things like nausea and vomiting because your inner ears and your eyes are going to be different. They're going to be seeing different things. You're going to be falling over and your body doesn't want that. So eyes should be level to the ground, okay? Next thing though, and this is where we notice a huge issue with posture, is going to be called forward head posture. It is what it sounds like. It means someone's head has moved forward. Now you can't see it as much from the front. Sometimes you can in people who have it really bad. When you look at it from the side, it looks like this. You see people who have their head, they're going like this. Or sometimes, even with the forward head posture, when it gets bad, they're kind of looking down. It's that moving forward. The head should be straight, more straight up and down over the center of the shoulders. So we got the center of the shoulders. Remember, these should be a little off, head in the center, eyes straight like this, then nose straight up and down like this. But the next thing is when we're looking at this too, and I'm going to kind of exaggerate, you see the next issue is going to come with the shoulders and the shoulders being rolled forward. So basically what's happening is we're seeing people that are kind of rolling and they're doing this, kind of going into that fetal position almost. Your body's trying to protect certain things, or where there's been an old injury that you didn't heal from, and your body's trying to contain that. So we start doing this as we get issues that are there for longer periods of time, and those bring on poor posture. So the other thing, and this is the last warning sign, but this develops usually after you've had poor posture for years, is right up in here, we start to get a hump. You've seen those little old ladies that have the humps. It's because that we've had issues going on for a long period of time. What happens is that the neck, as it starts to go forward, it's connected to the rest of your spine. As this goes forward, it's bringing the other part of the spine up like this. So the spine is actually being brought up and we're getting a hump. Inflammation is going around that area. That's why it can be kind of mushy and sink in. It can be very painful to the touch. And it's, again, what's happening is you're shrinking. We're getting people doing this. We want this. We don't want this, okay? And the nice thing too is that with all of this, it all works in conjunction. So if your head is going forward, but everything else is perfect, you're gonna feel a strain. Like I feel a strain back here. This doesn't feel comfortable. My head wants to do this. Now, if your head's doing this and just your shoulders start to go forward, it feels awkward. Your weight's being moved forward. Your body doesn't like that. So if we start working on the little things, let's say we just notice the shoulders and start getting them to go back, we work on that, you'll start to feel where the other problems are. That's why posture is a nice thing to work on, because when you work on that, everything gets worked on at once, every postural issue, because you can't have one without the other, okay? So look for those things. Take pictures, look in a mirror, look at your shoulders, look at your head, look at the upper back. See if you notice any of these abnormal posture things, but don't just do it with yourself. Do it with your spouse, do it with your kids, do it with other loved ones, because the time to really look is when you're not expecting it. When I'm planning to look, and I can, make myself look a little taller, I'm standing up a little bit taller, but when you're looking at someone and they don't know you're looking at them, that's when you can really evaluate their posture. So watch them as they're sitting watching TV. Look at them straight on, walk to the side, look at it from the side, make some notes. That's how you can really tell if we have postural issues, because the times when you're not paying attention and you're not trying to make it better that we really notice that. So that's your homework for this first video. Look and see if you have any of these postural issues I've talked about. Look and see if your family, friends, loved ones, kids have any of them. Then at least we know where we're starting from and we can go from there. So join me in the next video. We're going to pick up where we left off, but go ahead and look at those things. That's your homework for this video.